Shoulder is a complex joint which is formed by three bones. Posteriorly by the scapula, which is your wing bone, anteriorly by the clavicle, which is your collar bone, and laterally by your shoulder bone. So because of its complexity, it is also supported by many other structures, muscles, ligaments, etc. Because of its complex joint, it has got many structures causing it pain and leading it to the instability. So the very common shoulder complications are the shoulder dislocation and the frozen shoulder, which is again commonly seen in all the mid-age and the old age people, or the nerve impingement syndrome, in which your brachial plexus gets entrapped within the bones or the nerves, leading it to the nerve complications, or the acromial or the subacromial syndromes. So exercise therapy for the shoulder pain. So shoulder joint is one such complex joint in which most of its stability is maintained by the muscle surrounding it. So anteriorly it is supported by the pectoralis muscle, which is your chest muscle, and posteriorly it is supported by the rotator cuff muscles, which are your supraspinatus, infraspinatus, subscapularis, and teres minor, and laterally it is supported by your deltoid muscle. So the main aim of the therapeutic treatment is to reduce the pain and increase the function of the affected part. The main goal of the exercise therapy as a part of physiotherapy treatment is to modify the abnormal body anatomical positioning, which are contributing to the pain and dysfunction. Changes in the position of the scapula related to the humerus can cause secondary complications like soft tissue tightness, pain, altered muscle activation, or the muscle fatigue. So this results in the abnormal scapular kinematics and dysfunction of the scapulohumeral rhythm, which in potentially leads to the scapular pain. So the main aim of the exercise therapy or the exercise rehab is to protect the anatomical structure and the functioning of the affected area. And stage 2 is the stretching and relaxing the affected part. In this stage, the patient should be able to achieve full range of motion without any discomfort. And stage 3 is the strengthening. In this stage, the patient should be able to achieve full range of motion against the gravity and against the resistance without any discomfort. The same strategy is followed in post-surgical fractures too. So if you are working out regularly or doing the normal exercises regularly to maintain your general fitness, make sure that you're not finding any pain or discomfort while doing the exercises, because that's a red flag. And number 2, make sure that you are achieving a full range of motion. But in case if you're not able to achieve the full range of motion, that means there is some anatomical disturbance in your joint. And if you're working out regularly, you might work on your muscle strength, and if you're not able to achieve the strength, or if you're feeling weakness even after doing the exercises, it means your total muscle manual muscle strength is weak. So in that case, please approach Ayursh physiotherapy for individualized and customizable exercise therapy for all type of conditions.